Hello everyone, today we will talk about managing acute coronary syndrome or ACS. ACS is the most questioned area in PLAB exam. So here I will be discussing about the basic concepts of acute coronary syndrome. So if your patient is suspected cardiac chest pain, first you should start 12-lead ECG every 15 minutes. And if the patient is symptom free, you can repeat ECG at 1 and 4 hours. And also oxygen is a very important entity. If the patient is in pain, you can use GTN spray or IV GTN infusion. And yes, do not forget your IV morphine. And also oral aspirin 300 mg stat is a must in management of acute coronary syndrome. So now we will discuss about acute coronary syndrome with stable angina. In stable angina, chest pain usually comes with exercise, heavy work or heavy meal, and it usually resolves with rest. But acute coronary syndrome, that means unstable angina and myocardial infarction, pain comes at rest or at minimal exertion. And usually the pain in ACS is severe pain, and the patient usually complains of nausea, sweating and also breathlessness. So with ECG, you can clarify whether it is a STEMI or new onset left bundle branch block or non-STEMI. So as you know, if STEMI or new LBBB, you can always carry the PCI pathway. It is a non-surgical method which is usually used to remove the clot in the artery. So now we will see what are the ECG changes that are indicative of new ischemia. Usually there is a ST elevation more than or equal to 2 mm in 3 or more contiguous chest leads. Chest leads are your V1 to V6. And there is usually an ST elevation more than or equal to 1 mm in 3 or more contiguous limb leads. And also there is a new onset left bundle branch block. So these are the ECG changes indicative of new ischemia. If there is no STEMI or no new left bundle branch block, you can always do troponin 9. If troponins are taken 3 hours from symptom onset and if the levels are normal, acute coronary syndrome is unlikely. And if the troponin 9 is taken less than 3 hours and levels are normal, you should always repeat troponin level. If the Trop I is moderately raised, you can repeat troponin to access troponin changes. And if troponins are very high, you can start acute coronary syndrome treatment. Now we will see what is acute coronary syndrome treatment. Now we will discuss about the treatment of ACS. So these are the basic principles of management in acute coronary syndrome. First, keep in remember that antiplatelet therapy, which is dual antiplatelet therapy, 300 mg of aspirin and 300 mg of clopidogrel. And then comes your Fondaparinux, if available, subcutaneously. And also, beta blocker plays a very important role. For example, you can use bisoprolol. And then comes your ACE inhibitors. For example, you can use ramipril and Atorvastatin 80 mg. So these are the basic concepts of management of acute coronary syndrome. And don't forget that if patient is on oral anticoagulants, use dalteparin or enoxaparin instead of Fondaparinux. So keep in mind that these guides are made to aim the PLAB exam. So here I have used the nice guideline. So I hope you enjoy this video and it's useful to you. So let's meet from another useful guide like this.